think we've got a quorum here. Counselor Nofire, would you lead us in the invocation, please?
Thank you for the day. Thank you for all your many blessings. Thank you for bringing us all together here safely. I pray bless this meeting and that all good things come to be Cherokee Nation citizens. Pray that we end the meeting today safely and all have a safe trip home. In your name we pray. Amen.
Okay, Shelley, you want to take the roll call?
Yes, ma'am. Mary Baker Shaw,
Ani?
Mike Dobbins, Keith Austin, Harley Buzzard, Joe Byrd, Julia Coates, Sean Crittenden, Joe Deere, Kanan Duncan, Rex Jordan, Daryl Legg, Wes Nofire, Dora Petzkowski, Mike Shambaugh, E.O. Smith, Janice Taylor, Victoria Vasquez. We have a quorum.
Thank you. And first up for reports is Claremore Service Unit. Is George Velour on, please? Oh, George, good. Oh, I'm sorry, yes. All those in favor of approval of our minutes from our last meeting, please say aye. Aye. Thank you. Minutes approved. Now, George Velour. Velour, am I saying it better, George?
That's good.
Valier. I'm trying.
Everybody hear me?
Yes, thank you.
Good afternoon. Well, I think you have my report there. We have a 7-day positivity rate as of May 17th, 3.8%. As of so far to date, we've given 27,000, just over 27,000 vaccinations. We performed almost just under 20,000 COVID tests. Those have slowed quite a bit. For the month of May, or for April, we had 3,086 dental services. The lab ran 42,000, just over 42,000 tests on 2,100 different patients. Outpatient pharmacy filled almost 29,000 prescriptions for the month of April. We continue to work on the leased property. We leased some office space just west of the hospital, across the parking lot in a little strip mall there. We're going to move, the plan is to move some business functions over there, opening up some space in the hospital proper to be remodeled for more clinic space so we can see more patients. I'm told that we can expect to get be able to move in by the end of the fiscal year, by October 1. So that's our target, is to have them moved in, and then we can turn around and start working on the remodel for the hospital. Any questions?
Anyone have any questions of Mr. Valier?
Madam Chair.
Yes, Councilor Austin.
George, how's the vaccination for students going?
It's going good. We're not getting quite the response we thought we would. We've opened it up, and I don't know whether it's the summer, because it's summer, or what the reason, but I mean, we were kind of hoping they would be lined up out the door to get vaccinated, but that's not happened yet.
Well, I appreciate your efforts there. Thank you.
You're welcome.
That's open to all, right?
Yes,
Not just Cherokee at this point.
yes.
Well, I mean, not just Native American at this point.
Yes, that's correct.
Councilor Deere.
Hey, Mr. Valier, real quick, we talked about this the other day, but I want you to put it out there so people watching in all the districts will know what's going on, what you put out. A lot of people going to IHS to get the registry number for the $2,000, whether they go through the ER or anything. Will you state what your rules are, what you've implemented on that, so people will know?
We just took a real simple stance and just referred them back to their tribe. We don't register folks. All we do is sign you up to see for health care. We just refer everybody back to the tribe.
Okay. Yeah, because we were clarifying that people were wanting to go into ER to get their numbers at nighttime, and if that's the case, that's not going to happen at Claremore,
No.
correct? They need to get that from their tribe. So I just thought that needed to be stated, because that IHS has been blown up with that, so. But that, the nurses have other stuff, and doctors have other emergencies, but I appreciate it. Thank you.
Counselor Buzzard?
Yeah, yes, George, just to follow up on his question, have there been a lot of people do that?
Yes, sir, there have been.
Is that right? Wow. And then another follow-up, I didn't get to hear, the first you said there was a 3.8% positivity rate. How is that, how did you get to 3.8%? Was that for vaccine or?
For testing, for the few tests that we're still doing, and that's a
Okay.
moving 7-day average.
Okay, 7 days, okay,
Yes.
all right, got you. All right, thank you, Madam Chair.
Any other questions for Mr. Valier? I have one. George, last week it appears that the Creek Nation purchased the Cancer Treatment Center of America building complex there. Do you see that as having a direct impact upon the at-large citizens who are visiting at Claremore?
Not, it could, but not right off the top of my head, no, I don't. We get patients from all over, so I don't see it having a big impact.
A big impact, but it may have a small impact.
It might,
Yeah.
yes.
You don't know when they're planning on opening by any chance, do you?
No, I heard about it on the news also.
Okay.
That's all I know about it.
Okay, very good. Any other questions?
Has it been determined what they're going to use the facility for? I would assume they would try to get a joint partnership somehow with IHS. I didn't know they're still going to use it for cancer treatment.
They're not.
Okay,
They merely acquired the facility.
yeah.
Yeah.
Okay.
Oh, I'm sorry, yes, Counselor Deere.
Hey, Speaker, I actually talked to those guys, and they are going to keep the cancer part of it. And they're talking about doing a reduced rate to keep that, because most of the cancer places have left. And the rest of it, a lot of it's going to be hospital, so.
Okay, good.
They've got a little bit of work to do inside, but it'll be a little bit before they open it up, so.
Good news, yeah.
Yep.
Okay. Thank you, Madam Chair.
Very good. Any further questions, comments? Yes, Mr. Veller, thank you for coming down.
Thank you.
You have a good day. Appreciate you being here. Okay, next up, Cherokee Nation Health Services. Is Dr. Jones here?
Wayne's outside.
Who is?
Wayne.
Wayne? Ah, hey, Wayne. Good afternoon. Good afternoon, Wayne. How are you today?
Great, how are you doing?
I'm doing well. Thank you for coming.
Yeah, absolutely, glad to be here. I don't know that I've met everyone. Wayne Coldwell, I'm the Deputy Executive Director. I work with Dr. Jones and Brian and team in the Health Division there. So Dr. Jones wanted me to extend his apology for not being able to make it this month. I will try and cover the report as well as he does. I do know that the report was presented to you. I hope you had the opportunity to review that. A couple of high points that I know Dr. Jones likes to hit on, and I want to make sure that I continue that, is the Cherokee Nation Health Service Provider vacancy rate. It's 4.4%, which is great, compared to the IHS provider vacancy rate of 25%, which is a benchmark that they have there. Contract health services is always a hot topic. 97% of the contract health referrals were approved in the month of June. The other high point that I had here was the number of vaccines. To date, well, I should say as of last Friday, we received our report, and we had 62,220 vaccines distributed. Lots of great work going on out there from the health system as a whole. Kudos to our staff there. Two other points I wanted to hit on. Medicaid expansion. I'm sure we've all heard of the great things that the Medicaid expansion is bringing, not only to our tribe, but to our citizens. We do have a strong effort, a push to get citizens enrolled. There's actually a discussion going on right now where our team's forming, and we have started enrolling new Medicaid recipients, and that goes into effect July 1. So we're able to get ahead of it just a little bit. The other thing that I wanted to hit on, which I'm sure you've seen this, but it's a very important aspect. The expansion of the pediatric department in Veneta. We did a ribbon cutting on that a few weeks ago. It's a great thing and opens up additional care to the citizens that we serve. So we're glad to be able to do that. I don't have anything else, but I open the floor to questions.
Counselor Taylor?
I have a question. Wayne, when Cherokees give birth in our hospital, do we assist them with a citizenship right there on the spot? You know, Social Security comes in when you have a baby anywhere and says, do you want to sign up for a Social Security card? Do we do that for citizenship?
I don't know the answer to that, but I can get
Okay.
that back to you.
Okay,
Yes.
thank you. That's all I have.
That's a great idea, though, for not. Anybody else with any questions?
Yes, would you please get with Gail Miller before you leave? The Eastern Band, they're going to be here maybe this evening, and one of the first items on the agenda is a tour of our new clinic. And we wanted to make sure that we had the right person giving the tour. I think we're supposed to go through you guys. I talked to Dr. Jones last week, but you might get with Gail Miller when you leave and see if that's been taken care of.
Absolutely.
I got with Dr. Nolan on the OSU side, medical school, and he had somebody in mind, but we haven't taken care of the clinical side.
This
Appreciate
has been mentioned, Speaker Byrd, and I believe that we have it addressed, but I will double check with Mrs.
Thank
Miller.
you,
after this.
appreciate it. Thank you,
Absolutely.
Madam Chair.
Counselor Crittenden?
Yeah, Mr. Caldwell, I'm just going to say thank you for your accessibility. Had a few things that reached out to you about, and just right on the spot. So I appreciate you and what you do.
Thank you very much.
Thank you.
Anyone else? Okay.
I just have a comment.
Yes, please.
So on the CDIB and tribal membership, the first thing that you have to do, you have to wait about 4 or 5 months before you get your birth certificate, and then you can apply for your CDIB. That was the wait on all of us. So if that could be mainstream, that would be a great idea to go ahead and get it
If
started.
there's some way it could be combined, because a lot of people, you know, they have the baby and then they can get health care on mom and dad's card, and they don't think about it till they're going to high school. So if
Yeah,
there's
because the copy of the birth certificate would
something-
be right there in their hand as they're filling it out when the baby's
Yeah.
born. So that would really expedite the process. I think that's a great idea.
Yeah. That is a great question. We'll definitely get some responses back to you and look into our processes
Thank
if
you,
we
Wayne.
can improve it.
Counselor Buzzard?
Yes, what is the positivity rate on COVID there at Hastings?
I don't have that in front of me. Me, Chief and staff and I were just discussing that. I don't know that he has a response on that as of yet, so.
Can you get that?
I will definitely get that to you, and I
Okay.
can circulate it to the committee, no problem.
Thanks, sir.
Wayne, I have a question.
Absolutely.
On the Medicaid expansion, how will that benefit Cherokee citizens?
So for one, it's additional access to care. You know, one of the things that, criteria for contract health services is that you do, on certain procedures, you do have to have a payer source. And this allows them to have a payer source, and it allows us to use those dollars that we before would have been spending on care, and we're able to provide additional services through contract health services to these patients. Basically spreading our scope of care to the citizens.
And maybe saving some on contract health then?
Correct.
Okay, I know so many of the, I guess, insurance companies are now going to managed care. Is that similar to what is happening with the Medicaid expansion?
It is similar. We do have a group together working on that as well in conjunction with our Medicaid expansion team. So there's more to come on that. I know there's been some things tabled and, kind of pushed to the wayside, but they're trying to get a little bit more traction on where Medicaid, or the managed care piece of this will go.
Wonderful, wonderful. At what point has our tribe, have we thought about all the COVID babies that should be coming in the near future?
We had a surge of deliveries. I don't remember exactly when that was, not too far back, a few months. But yes, we have been evaluating that and trying to figure out where do we need to put our resources at to best benefit the citizens as they come through to deliver their babies with us.
Our newest citizens. Okay, and I guess that's all. Is there any other questions from anybody else? Yes, Counselor Smith.
Another advantage of, if we could sign them up quicker, would be the schools. There's 14-year-old kids going to school that they don't get any money for.
Yep.
So
Absolutely.
I wish we could do something we wouldn't have all these calls about people with 14, 16-year-old kids that can't get their money. So that's something we could do. Thank you.
You know, I do want to tell council, share here, that when they're dealing with more than 1 million patient visits a year, for those 1 or 2, 3 calls we might get over the weekend or whatever, I mean, what an amazing job you all are accomplishing in the grand scheme of it all. I mean, it's huge. And I'm really proud of the way our system's maintained and managed. It's just quite remarkable. Please pass on those congratulations. Anybody else have any further questions? Okay, so thank you so much for coming. Appreciate it.
Yep, thank you, and if you all need something, just reach out.
Okay. Next up on our agenda today, we have PACE. Thelma, are you with us? There she is, yes. Thelma always gives the best reports.
Good afternoon. Thank you for having me. PACE is doing well. We haven't had any participants that have tested positive since January. We have 195 today. We lost one since I sent this report. We are anticipating 7 more participants in July, so hopefully we will break that 200 mark finally. We have 25 folks in assisted living and in nursing homes. We have dispersed 120 grandpads, and in fact, we had our first dietitian socialization with our grandpads. 67 of our participants attended, and they were taught how to do a smoothie, so, by our dietitian. So we are utilizing our grandpads. We have at least 65 to 70% of Cherokee or Native employed of our 71, and the remainder are non-Native. Are there any questions?
Anyone have any questions today?
Madam Chair.
Counselor Dobbins? I'm sorry.
Thelma, on page 15 of the report, it says that the adult daycare center is closed.
Yes, sir, it is. We anticipate opening July 5th, hopefully, with a scaled-down participants. We were running 80 every day in our day center of our 190 at that time, and we're scaling it down to 40 so we can keep social distancing and masking and so on to protect our participants because they are frail and elders. So that's what we're anticipating right now.
But you anticipate opening then July 5th as well?
Yes, sir.
Okay.
To get our first initial participants back in the daycare center. Our clinic has been open all through COVID. We have transported them one at a time in vans to keep them safe. And they have been utilizing our clinic with our providers. And of course, if we could not do what they needed there, we sent them to specialists. So.
Right. Thank you, Bill. Thank you, Madam Chair.
Counselor Austin?
Thank you. You spoke of 0 cases of COVID since January,
Yes, sir.
which I'm assuming that means before that you had numerous cases.
Before that, we had, I'm not quite sure of that number, but I think out of 45 participants that we tested, I think there were several positives, but they stayed within their home. And we had 7 deaths, 1 in September and 6 in December at the height of COVID, and they were all in nursing homes.
And so what changed in January?
What changed in January? Vaccination, social distancing. I couldn't really tell you. It just started to downscale, and we worked with our providers and followed the Cherokee Nation utilization and their policies, CDC policies. We were very, very careful to only transport 1 participant at a time. And the nursing home population was the most heavily hit by COVID.
Well,
And
I thought it was very important that the fact is the elders were the first in line to get COVID.
Yes.
Which was in January, December and January.
Yes.
And for you to then in January start having 0 cases.
And also our staff,
Yeah.
were first in line to get it because of the frail elderly people we serve.
It's just an important story for people to hear of that turning
Yes, sir.
point in January.
Yes,
Thank
sir. It was like it turned just, in January when the vaccine started.
I appreciate it. Thank you for your efforts.
Any other questions for Ms. Pittman?
Okay.
Thank you so
Thank you, ma'am.
much. We appreciate it. Okay, next, I believe we have on the phone Kristen Crawford for April Moore. Kristen, are you there?
I'm here. Can you hear me?
Yes, can you hear us?
I can.
Okay, would you like to give us your report, please?
Sure. Yeah, I think you guys have the report in the packet. I don't have anything significant to report. Kind of like with PACE, we saw a drastic drop in COVID early this year. So that's been going well. We haven't had a positive patient. Honestly, I can't remember when. Same thing goes with our staff. So I'll just open the floor to any questions you guys might have.
Anyone have any questions for our Cherokee Nation Home Health Services here? I have one, Kristen. Kristen, when someone refers to you, do you all go in and do an interview? How does that work?
Well, we have home health and we have hospice, but in both of those cases, whenever we get a referral, we do send a nurse out to do an evaluation to determine whether or not the patient qualifies for services, and then we just kind of go from there.
Is the services that they qualify for, is that economically based?
No, I mean, we are reimbursed by Medicare, Medicaid, and insurance programs, so we do have to have a payer source, but beyond that, it's just medical qualifications.
Wonderful. Anybody else with any questions? Well, Kristen, thank you. You get out and enjoy this warm day.
Thank you, you too.
We appreciate you being with us. Thank you. Okay, any old business? Any new business? Announcements. Our next meeting is tentatively scheduled for July the 12th at 1 p.m. I'll take a motion for adjournment at this time. Second.